Good afternoon, everybody. Welcome back from lunch. My name is Unnati. I'm an assistant professor in marketing at the University of Illinois at Urbana-Champaign. I use field experiments and quasi-experiments in my research, and this is the first time I'm attending this conference. I'm super thrilled to be here. Also want to preface this by saying I'm not a health economist. This is a very different project from what I would typically do. Typically, you would see me studying things like mobile apps, retailing. But in one stream of my work, I study different kinds of nudges to get consumers to act differently in a variety of online and offline settings. And that's where this project belongs, where I'm studying the role of financial and non-financial incentives to get people to work out more, hopefully, right? So why am I looking at encouraging people to work out more and be more healthy? Well, we know that the cost of managing disease and just in general, healthcare costs are rising rapidly. Most countries today, including the US, spend almost 20% of the GDP managing healthcare. Within that, there are some preventable premature deaths, causes related to obesity, health-related heart diseases, as well as type 2 diabetes that can be regulated if we were to invest more in healthy behaviors and fitness. By some estimates, over $190 billion seems to be the direct cost of managing these types of diseases. And if you start thinking about loss of productivity, this cost can run up to trillions of dollars. As a result, firms, governments, we all care about getting consumers to be more fit and healthy. However, consumers struggle to keep up their health-related commitments. So how many of you, by show of hands, had some kind of health resolution this year? You did? I'm not going to ask how many of you followed through. Hopefully some of you did, since we're all in the health session, some selection bias, right? However, what we can know from here is that even though consumers struggle, they could respond positively to certain types of incentives. And in some other settings like education, Stephen Levitt has shown, for example, younger people actually interact better with non-financial incentives, and they tend to behave more in line with the incentives. What I think, as far as my reading of the literature and just talking to different people, a lot of research has looked at either financial or non-financial incentives, but there hasn't been a whole lot of clarity on what would happen if we combine these two types of incentives, especially looking at both the short-term and the long-term results for different kinds of individuals. So my research specifically asked two different questions. The first is, what would be the effect of financial and non-financial incentives, both given separately as well as when we combine them on workout participation? I do this in the group fitness context in a large public university in the US. And what kind of financial and non-financial incentives do I give participants? In financial incentives, I would give them real cash or money for actually working out a certain number of times every week. In the non-financial condition, I would give them weekly information about their peer rank. So that'll be my specific treatment of interest. And I'm going to measure these effects during the incentive period as well as after. The second research question then is, are there any heterogeneities, especially looking at their workout goals? Are they trying to lose weight versus not? Because this could relate back to their intrinsic motivations and so on. And the second will be, are they existing members of this kind of a fitness program versus are they new members? And this can help resolve some of the mixed findings in the literature, which already has looked at financial incentives and non-financial incentives separately. So for the rest of my about 10 minutes of talk, what I want to focus on is give you a little bit of idea about the related work, which I think this audience doesn't need too much of. The second thing I will do is talk about my specific experiment design and show you some results. And just to let you know, I have been running these studies and just finished the data collection 2 months ago. So everything is going to be preliminary results, and I welcome any feedback. So what's been done already? If you look at the gym-going behavior specifically, there's already work that looks at financial incentives, and the literature finds mixed effects. Some studies show a positive effect. Some studies, including the Damon Jones, who's at University of Chicago, he's done some work with U of I folks, Julian Reif and David Molitor, showing that workplace wellness programs actually don't have a sustained increase effect on people's health-related behaviors. So what we find then is this mixed effect of financial incentives. Similarly, non-financial incentives in this setting, if you just give people reminders to work out more, there are studies, the Kalsori paper is published at Management Science. So a lot of business school research has also looked at what would be the effect of reminders and subtle nudges, and they find a positive effect, at least even in the long run, depending on your referent group. But what we don't know fully is what happens when we combine these incentives, and why should that have any effect? Well, there is one recent Journal of Marketing research paper which uses observational data to measure people's footsteps in a corporate wellness program. So the company wants people to walk more, get more footsteps during their day. And so they find that adding social interaction-based nudges to monetary incentives actually makes them work better. And similarly, there's another study in management science which shows that conspicuous incentives help a lot more over and above just giving money. So the idea here is we don't know exactly what would happen when combined. In addition to all the gym-going behaviors, there are other contexts like savings. How do you get people to save more? Or how do you get people, for example, to be more creative? In which financial and non-financial incentives have been studied. Again, we know a lot about how they work separately, but there's very little work showing when combined, potentially people will write more reviews on a website like Yelp, for example. So that's going to be my main focus here. Okay, so what is my experiment design? For the rest of the talk, I want to show you what I actually did in my studies and how that resolved some of these mixed findings. Okay, so I ran a field experiment at a large recreation center at a public university in the US. This is a fairly large center, garners about 1 million visits every year from students, staff, faculty. And my participants in the study are going to be everybody who's paid $60 for the entire semester to participate in these group workouts. So these are already paid members, and what I want to do is see if their workout activity can be improved. What are my specific conditions? So I randomly assign them to 4 different groups. In the financial incentive group, I tell participants that upon completing 2 workouts per week for the next 4 weeks, they can get a $30 gift card. In the non-financial incentive condition, as I said before, I give them their actual peer rank. So if you're somebody who attended the maximum number of classes among your peers, you will get an email saying, hey, last week you ranked number 1 among your peers. And so week by week, they can actually see their rank. In the third condition, which combines both of them, I offer them both this $30 gift card as well as information about their weekly peer rank. And in the control condition, they don't get any of this incentive. So all groups are, in addition, invited to also fill out a pre-study survey in which I ask them, hey, are you trying to lose weight? What are your intentions from this program? And I also can get their past data about were they past members of the rec center or not. And about 50% of them completed this survey. So just to summarize, in my experiment design, I have 694 total participants who were sent out invitations, randomized into these 4 groups. About 170 were in each group. And out of these 694, 46% completed the survey, so I have some additional data about them. I did, obviously, randomization check to make sure randomization worked. Here I'm showing you 4 different variables. 2 of them came from the survey, so that's for the subsample which reported their age and gender. But in addition, I can also track from the data recorded about them whether they were past members. About 10% in each group were members before. Their workouts ranged from 16 to 24, but this difference was not significant. And the past workouts are based on the semester before my interventions ever started. So what do I find in terms of the results? So first, we're going to look at the intent to treat effect, which is everybody who was randomized and invited to this program. And I don't find any significant differences in their number of workouts completed over the 4-week period. So if you look at their total workouts, there's no difference between the 4 groups. If you look at types of workouts, so if I went to 2 yoga classes and 1 cardio workout, that would be 2 different types of workouts. Again, I don't see any difference across these 4 groups. There's no significance. Where I see some action is goal completion. And remember, the goal here is, can you complete 2 workouts each week for 4 weeks? So the people who do that more are the ones in the financial incentive condition and the combined condition, with the combined condition slightly being better, but not significantly different from this one. And so then for the rest of the 5 minutes, I'm gonna skip the regression results and talk to you about why this is happening. Why is goal completion better for people who actually are in the financial incentive or the combined conditions? So I do this by looking at 3 different things. First, I look at more people who actually took up the survey and joined the program. So this will be like a treatment on the treated kind of result. Then I look at effect week by week during the 4 weeks, and I also track them 4 weeks out of the program to see if there's any effect on persistence. And finally, I look at some heterogeneity to try to explain these results. So on the first one, which is the treatment on the treated effect, here I find much stronger effects for FI, which is a financial incentive, and the combined incentive for all 3 of my workout participation metrics. So not just goal completion, but they actually perform much more, almost 50% more in these other metrics too. So that's a really big effect, conditional on actually filling up the survey and joining the program. What I also find, and this to me was super interesting, this is a plot I did 2 days ago, but I really found this interesting, so I included it. The point here is if you look at financial incentive only and look at the results week by week, the treatment ends at week 4, but the effects already start to die out in 2 weeks. If you look at the combined condition, it seems like till week 4, the effects are still kind of there. They take a little while to start, but then they continue to be significant till about week 5. So to me, it seems like adding on the non-financial incentives on top of the financial incentives may be making them more persistent, which is something we actually care about. Because a lot of the studies will show that, sure, there's a short-term spike, but then effects kind of die out. So how can we help people create these healthier, sustained habits? Moving on to the heterogeneity. So who do you think the financial incentives work more for? How many of you think they work better for people who are trying to lose weight? How many of you think they work better for those who are not trying to lose weight? Oh wow, this audience knows their stuff. I have nothing to me, these are all surprising results. So I'm glad you guys picked up on that. So if you don't have a weight loss goal, apparently the financial incentives work better for those people, at least for number of workouts. And my intuition is that it's because their intrinsic motivation is already probably not too high, so they benefit from this. But for this group, maybe they're already intrinsically motivated, and giving them extra rewards crowds out some of the motivation. But if you all have other explanations, I'd be happy to hear them. I similarly find that for both FI and non-FI condition, the people who are trying to lose weight, actually they benefit more from this and they start to work out more. So an implication of this can be a lot of programs are targeted to help people who actually want to lose weight, and for them these combined incentives may be a better strategy than just giving people money to work out. My last set of results before I close out, if you were existing member, so past member equals yes, then you have a higher effect of financial incentives compared to if you were not a past member. And same for combined incentives. If you were a past member, you'll work out much more if you're given these incentives. And a lot of previous literature has looked at only the effects for new members, which is why probably they find null effect. That would be my intuition. Just some regressions. So overall, this study had 2 questions. The first question was, what are the effects of financial and non-financial incentives on people's workout participation during and after the incentive period? I look at 4 weeks of the incentives and 4 weeks after. What I find is there's no intent to treat effect on number of workouts and type of workouts. But if you think about goal completion, you see a lot more effect for goal completion. About 80% more people complete the goal just by being assigned into financial incentive and combined conditions. I also find significant treatment on the treated effects, but there is no effect of non-financial incentives even in that setting. Finally, non-financial incentives appear to make these effects much more persistent, and that could be an important implication for practice, maybe due to delayed rank information. I also have some heterogeneity results that I've shared with you. Financial incentives, as you all guessed correctly, was more and more effective for those who were not trying to lose weight, while non-financial and financial incentives combined were more effective for people who were actually trying to lose weight. And also existing members benefit more from these workouts and incentives. Okay, what are my next steps? And here, obviously, I can use some ideas, but my current implications are that combining the two incentives can be very effective. It's also more low cost because just giving financial incentives can be an expensive strategy. So adding on non-financial incentives can be a good nudge that practitioners can use. It can potentially be effective for those who are trying to lose weight. And finally, for new members, as well as I want to look at some of these peer effects and rank-based findings. Maybe people who are low ranked versus high ranked behave differently, and those are some things I'm currently exploring. I also looked at some alternative DVs and outcome measures, such as do people's ranks improve if they're assigned to the non-financial incentives, but I didn't find any evidence of that. I will pause here and take any questions or comments or suggestions.